name's Sharon Crary. I'm a professor of chemistry and biochemistry, and I'm also a co-director of our global health program here at DePauw. And I want to welcome you all today to the 2023 Hampton and Esther Boswell Symposium. This year's symposium is called Zoonotic Diseases in Our Current World, and it's a very exciting day of seminars about zoonotic diseases, and it's offered with the support of the Hampton and Esther Boswell gift that was made from the Thomas W. Boswell 66 and Cheryl K. Boswell made this gift in memory of Mr. Boswell's parents. We're extremely grateful to them for this gift. It's made a wonderful opportunity for our global health program this year. The symposium's actually been organized by Max Moreno, who's our distinguished visiting Boswell professor for the year, and has offered an enormous number of wonderful and well-loved classes for our global health students this year. Max came to us from a position at Indiana University, Purdue University in public health. His history is that he received a bachelor's degree in zoonotics in Columbia, his master's degree in environmental management for sustainable development, and his PhD in public health at the University of South Florida at Tampa. He did a postdoctoral fellowship work with the NASA Marshall Space Flight Center at Huntsville, Alabama, which is probably the most interesting postdoc I've ever heard of, and has been working ever since on environmental issues and zoonotic disease, and has really shared his love of that and his expertise in that field with our students this year through so many of his opportunities. We're very grateful to the Boswells for making this possible. I'm really excited that you're all here today and hope you continue to come all day. And I'm sorry, Max, I didn't change to your picture when I was talking about you. So everyone, please welcome Max. He'll give us an introduction to the field, and then he'll introduce other speakers throughout the afternoon. Thanks, Max.
Thanks, Dr. Grady, and thanks, Dr. Beauvais, Dr. Hall, for presenting here. Dr. Pare, who is still coming, he is driving around. He's lost the direction a little bit. Thanks to all of you, both attending physically and virtually, and especially thanks to the Boswell for making this event possible. So we are here talking about the terminal zoonotic diseases, and I want to start with this trend line that is decreasing, showing the mortality due to infectious diseases worldwide. And this decrease in the trend line is thanks to the advances in medical, public health technology, and sanitation infrastructure. And there is also a decrease in the number of cases due to infectious diseases. However, there is a rise on the number of outbreaks due to zoonotic diseases. And in fact, 3 out of 4 of those infectious diseases outbreaks are due to zoonotics. So we see in this trend line how the frequency of zoonotic outbreaks is increasing as you advance to the right of that time axis. You see how the interval between outbreaks due to zoonotic diseases is getting smaller and smaller. And most of those outbreaks are due to viruses, bacteria, and they are mostly non-vector transmitted diseases. So as I say, 3 out of 4 of those new emerging outbreaks due to infectious diseases come from animal origin, so they are zoonosis. But not considering only those that recently emerged, but in general, talking about all infectious diseases that affect society right now, about 60% of all infectious diseases there are right now, they come from animal origin. So 1 out of every 4 people is actually affected in the world by a zoonotic disease. So to put that into perspective, we can compare it with 2 diseases that are leading cause of mortality worldwide, diabetes and car accidents, and we see how zoonosis is just twice as severe as those other 2. Here we have a better perspective with many more diseases, those that are leading causes of death worldwide. And you see the 2 red arrows corresponding to the 2 previous diseases that are very high in the list. And we don't have a red arrow for zoonotics there, but they are distributed among the digestive, respiratory, lower respiratory infections. So that gives you an idea of how important this topic is. And then knowing how important it is, then it raises the question, why? How is that happening? What are the factors that may be explaining this emergence, this increase in the number of outbreaks due to zoonotic diseases? So there are several factors, all of them somehow related. One of those is climate change. Climate change influences many different aspects of infectious diseases and zoonotic diseases, in special those that are transmitted via vector, the vector-borne diseases. But in general, it affects all of them. And through different pathways, probably the easier to analyze the relationship is the increase in temperature. This increase in temperature cause a redistribution of the geographical habitats of many vectors of diseases, and also of the conditions in general for those pathogens to be transmitted. But it's not just only temperature. Other indirect consequences of climate change, like rainfall, floods, droughts, storms, they are all related to the suitability of habitats, breeding sites for vectors of mosquitoes, and also have to do with the interruption of sanitation infrastructure in general that leading to health. So you see there, sea level rise. You will wonder how come sea level rise has to do with zoonotic diseases. What will be the relationship? Actually, there is a large extension of land worldwide dedicated to agriculture that is located near the sea level, near the coastline. So this land is expected to be flooded as the sea level rise. So that means a huge extension of land that is currently dedicated to agriculture will be flooded, and that have to be displaced further inland. So that means pressure, an increasing pressure on the ecosystems inland, on the forest. And that's how we come to another of those pathway land cover change, because that agricultural land that is displayed is expected to advance further into the forest, and that has another problem. It is related to the influence in this increase of zoonotic diseases many different ways. One starts from the very beginning, from the very process of deforesting, of timbering. When the people involved in the work of cutting those trees are in the action, well, obviously they are far away from urban center, from the grocery stores. So they rely on bushmeat that they can find locally. So that increased the contact between the workforce and the wildlife. And in fact, that has been proposed as one of the reasons, or probably the reason of the Ebola pandemic. So deforestation in West Africa has been linked to Ebola, and it's believed that has to do something like that, in which people consuming bushmeat come in contact with the fluids of wild animals. So after that land has been deforested, then it's replaced with agriculture. Because this land is tropical, it has a very thin soil layer and a very high precipitation. This soil is flushed down very quickly. So it means this land cannot support agriculture for a long time. So in a matter of a few years, the soil is no longer able to sustain agriculture, and then is displaced by cattle rising, which is less demanding on quality of the soil. And with cattle rising, then it follow swine, follow poultry, and follow all those domestic animals that will be then in increasing contact with the wild animals in the neighborhood areas. And that will facilitate the probability of spillovers. Another factor is the globalization. You see in this graph to the left, you have the graph for the export, the graph for the air travel. You see how it has a steady increase. You see the comparison between 1933 and the present in terms of connectivity worldwide. You see that map on the bottom, very busy, very crowded. And so that just show the interconnection and the easy for people to travel worldwide. So what is the issue with this? There are many. The main one is probably the speed of traveling. And to get an idea of that, let's take a look to this. By the time of the Spanish flu in 1918, that pandemic that was zoonotic and killed about 50 million people worldwide, the distance, the time required for somebody to travel from Hong Kong to London or vice versa was about 25 days. So that means that if somebody is carrying a pathogen, that is more than enough time for this person to show symptoms, for the pathogen to complete the cycle, to complete the incubation period. And then authorities could take a measure. They could identify the case, and they could apply quarantine to this person and those who have been in contact with it. So when the ship arrived to port, then there will be less or no chance of that pathogen to spread into the community. However, today, for somebody to cover the same distance, it will take just few hours, less than half day. So that is much shorter than the incubation period of pathogens. So that means that the people can travel, can carry pathogens without knowing. And when symptoms are shown, the person may be already at home after have been in contact with many people in the airport and in many different places. So then, obviously, the chance of spreading of that pathogen is much higher. Also related to globalization, let's talk a little bit about NAFTA. This agreement is no longer in place. It has been replaced by a new one. But the fact that is that globalization is increasing the number of free trade agreements. So those free trade agreements, they usually include a chapter for foreign direct investment. So that means that the multinational can take advantage of the low taxes, the low salaries, the low regulations in developing countries and build factories there. This has been also proposed as the origin of the swine flu of 2009, because thanks to NAFTA, a big multinational of swine production built an industrial farm in Mexico, from where is believed to have been originated the pathogen. So the other factor is the growing the population, and you see in this graph that most of the red bar, which is the total population worldwide, is explained by the green bar, which is the population in developing countries. The blue one is constant, so it means developed countries maintain a steady population, they are not growing, but it's developing countries who are providing the most of the growing the population. Why this is important? Because developing countries are those more likely to receive these industrial farms that, as we mentioned before, because developing countries are those more likely to be in tropical areas where there is a high precipitation and there is the forest, the tropical forest, the jungle, which is the source to a number of wild pathogens. And that is the area that is being deforested and putting in contact domestic and wild animals. And also because developing countries are those who have the less infrastructure, the less public health infrastructure and surveillance and monitoring to detect outbreaks and to control if they happen. So then it's not just that most of population is growing in developing countries, but also that most of population is growing in urban areas. Since 2008, there is more people in urban areas than in rural areas. And then how that linked to zoonotics? Well, people living in rural areas, they are more likely to get food from their own backyard, from the own traditional systems, which are usually of low density and don't imply too much risk of transmission. But people in urban areas, they depend from the food that they access in the grocery store. This meat they access in the grocery store usually come from industrial farms, which have high stock densities and the higher chance of transmission of pathogens. So we see here the global animal protein demand. We see how it is increasing steadily. Only in North America and Europe seems to be in a plateau recently, but other than that, all the world, and especially China, is in a steep increase. So the demand for this animal protein is increasing, and among the species that are main protagonists in the supply of this animal protein to this growing demand are the poultry and swine, which play a very key role in this process. Let's take, for instance, the case of influenza. This virus, it's believed that, in fact, the Spanish flu came from a strain of influenza that came from the wild bird. So the wild birds are the source of this type of harmful strain of influenza to humans. And it's harmful to humans because this strain have been evolved to be adjusted to birds, not to be adjusted to humans. The fact that it's not adjusted to humans make it very lethal to humans. But the good thing is that it's not so infectious to humans because it has not evolved to be adjusted to humans. However, it can still infect swine. It doesn't infect humans, but can still swine. So then here the problem is that the swine, which is also another of those species that is called to be a main protagonist in the supply of animal protein for this growth population, swine can receive the strain from influenza from humans, can receive the strain from the influenza from birds, which is very harmful to humans. So these two strains can exchange genetic material, what is called as resortment. And then the possibility exists that this resulting pathogen will inherit the ability of the avian flu to be harmful to humans and the ability of the human flu to be very infectious to humans. So here you have a pathogen that is both highly infectious and highly lethal, which is the worst ever combination. So continue talking about swine. You see these two pictures, one a more traditional type of swine growth, the other the more industrial type of growing swine. You see that in one of the bottom, where swines are in low stocking density and they are roaming around. If a swine gets sick, it just don't move and doesn't walk to come in contact with the next susceptible host. So the chance for a pathogen to be transmitted is lower. But the image on the top shows that even if an animal is sick, it is still shoulder to shoulder with the next susceptible host. So the possibility for transmission is much higher. Luckily, the industry of swine production is aware of this risk, and they take very good care of the surveillance, of monitoring, of all the biosafety to make sure there is not a risk. Still, some biologists like Bob Wallace, in his book, Big Farms Make Big Flu, say factory farms are the best way to select for the most dangerous pathogen possible. And here you have this building that looks like a hotel, 26-story building, is actually a farm. It's an industrial farm. This is in China, where the demand for consumption of animal protein is growing. So this farm can actually, it was inaugurated recently. It is designed to produce 1.6 billion swine in a year. So you see to the left, all the infrastructure dedicated to process the food, the concentrated, the formulated food that is dedicated to those swine. And obviously, they have this huge biosafety measure I mentioned. They are constantly surveilling their animals, paying attention to the minimum detail of animal being sad, being sick, animal being coughing. People, the workers in many of those industrial farms, they look like astronauts. They follow very careful protective personal equipment because they are aware of that risk. However, even though they are so good at making sure there is no risk that any of those potential pathogens will find a way out of that place into the community, it happened that with globalization, those industrial farms are increasingly going to developing countries. Well, the farm may have all those measures of control, but next to that may be surrounded by traditional farms like this that have no any biosecurity. So that is the problem. The problem is not so much that the pathogen will get out of the industrial farm, but if it does for any reason, then once it is out from one of those places, it could easily get spread into the community because there is no biosafety measures here. And it has been also proposed that the Spanish flu of 1918, even though there was not industrial farms at the time, but still there were the regular farms, still it is thought that that resort between avian flu and human flu happened in swine and caused this pathogen that was highly infectious and highly harmful that resulted in killing 50 million people at the time. The world population was 0.7 billion. So that proportion in today's population of about 8 billion will be more than 223 million people dead. So that gives you an idea of the severity of that pandemic. And that pathogen we still have today is one of those that circulate and are responsible for the common flu that we have every year. Now is not lethal because now after those years, it has evolved to be adjusted to humans. So in the process of adjustment, he tried to be mild because if it's harmful, the person just don't get out of home, stay on bed and cannot be in contact with other susceptible hosts. If it's mild, then the person is more likely to not show symptoms and keep walking and keep coming in contact with other people. So then the ability for a pathogen to be mild has more success than one to be harmful. So in the long run, pathogens tend to be mild. That's why probably COVID started being more harmful, and now COVID is very mild as it has been evolving and adjusting. So with this, I finished my presentation. And I am ready for any questions if you have.
In an increasingly connected world, what, if any, policy changes are in progress to coordinate international action in response to pandemics?
Definitely, that is what needs to be done. In fact, that has been proposed repeatedly now with COVID. Has said that should be a kind of a fund and a kind of organization that is placed in ready to respond to any situation like that. So it is expected that more pandemics will come. So that will definitely require some organization between countries, and that is actually global health. So that is definitely urgently needed, but there is not one in place right now. The closest to that is the World Health Organization. That is the closest in terms of organizations that can coordinate all the measures worldwide to prevent a pandemic.
And this is a two-part question. Recognizing the risk of emerging diseases, what proactive steps can be taken in the realm of policymaking rather than reactive steps?
Well, monitoring, surveillance, paying close attention to the minimum show of symptoms, both in farms and also in cities. Like the earlier any of these outbreaks is detected, the better it is. So definitely it needs to be surveillance, 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 and also favoring means of activity in which there is not so much requirement for crowding, which make it's funny because here we are crowded, but any politics that will tend to have less people crowded in small areas will also help.
There are some more questions from the Zoom audience. If there aren't any more questions from the audience. What is the rate of appearance of new zoonotic diseases? In other words, how often will we see pandemics?
Well, for instance, in the case of pandemics due to influenza, which is one of the most common reasons of pandemics, they are happening. That is actually not a new thing. It's just that recently the frequency is increasing. But in the past, since the Middle Ages, we are having at least since 300 years ago. There is actually a paper that goes back up to 300 years ago, showing the frequency of pandemics due to influenza, and they are happening roughly about every 20 to 30 years in the past. But now that interval of 20 to 30 is getting smaller and smaller. So then that if you analyze that the Spanish flu happened in 1920, we are most than due, but if you count that also there have been other pandemic due to other diseases very recent, then we are probably very close to the next one.
Thank you.
You're very welcome. All right, so the next speaker is Dr. Bove. She's a doctor in veterinary. She is also a PhD in epidemiology. She is assistant professor at the Purdue University. So she is also working on a project researching the risk of biodirectional transmission of influenza between workforce and swine. So please, Dr. Bove.
Okay, good morning, everyone here, and good morning on Zoom as well. Thank you very much for the kind invitation and introduction. As Max mentioned, we've been working together on this project that's funded by the National Pork Board, together with Dr. Ragland, who's also with us today. And I'm going to try very hard to keep to time. Okay, so please let me know as I approach the end. So Max gave us a very nice introduction to the landscape when it comes to infectious diseases and this issue of spillover of zoonotic pathogens between livestock and people, and of course wildlife play a role in that as well. You may or may not know that influenza is a member of the Orthomyxoviridae family of viruses. You probably are aware that it's common in human and animal species, and that it's typically transmitted via respiratory droplets, so facilitated by coughing, sneezing, and breathing. And this is the same in our livestock species as well as in humans. So from a point of view of the swine industry, influenza is important because it places an economic burden on our swine farmers because of the relatively high incidence of disease. Although it's fairly mild, it does affect the time that it takes to raise these pigs from piglets to slaughter weight. And so that's carried forward and in terms of a cost to the farmer, as well as the costs of treatment and so on. And it's also a concern because of the swine workforce, right? So we have a population of people who have very intense contact with these agricultural animals through kind of daily feeding and monitoring and treatment of the animals. And so it's of importance from a point of view of workplace safety. And then from the broader point of view, as Max has discussed, we have this issue of we know that the more interspecies transmission that occurs, the greater the likelihood that a pandemic strain will emerge that could have an impact on the broader human population. So thank you to Dr. Ragland for this picture. This shows a fairly typical indoor swine unit here in Indiana. And so you can see that what happens is roughly every 6 months, new piglets will be brought into this room, and then they'll remain there until they reach slaughter weight. They're kept in pens, but within the room, there's a high level of contact between the pigs. Typically, we might have 1,000 pigs approximately in a room, and a farm might have approximately 4 rooms. And surprisingly to me, at least, was that typically you may only have 1 or 2 workers that are having contact with this group of pigs. So it's a fairly small human population, but nevertheless, they're having quite intense contact when it comes to transmission, the potential for transmission of diseases. And as has been mentioned, there are fairly intense biosecurity measures typically. So there would be restriction of personnel on the farm. As you can see, the slats in the floor to try and kind of prevent accumulation of feces and ventilation and so on to try and reduce disease transmission. So when it comes to influenza, there are a number of control measures. None of them are kind of extremely effective at reducing the transmission, but together they can kind of reduce the likelihood of spread of influenza throughout swine. So typically these are what we call all-in, all-out systems, or some version of that, which means that these rooms get completely emptied and disinfected before the piglets are introduced. And then those piglets remain as a cohort together until they are sent to slaughter. So this allows for a kind of break in the production cycle where cleaning can happen to reduce the transmission of diseases from batch to batch. There are vaccines available to vaccinate either the sows when they're pregnant with the piglets, which results in some transfer of maternal immunity. And there are also vaccines available for the piglets. However, these are not very efficacious vaccines, so they only provide some protection. And then we have general disease prevention measures like cleaning, ventilation, isolating sick hogs, and so on. And finally, in terms of protecting the workforce, there's personal protective equipment. So commonly masks would be worn by the workforce in these units. And a big reason for that is that there's a lot of dust. The air quality is not great. So commonly they would be wearing masks, but when it comes to the kind of level of adherence and the level of care that it takes to avoid transmission of influenza, it may not be good enough. I think we've all kind of come to learn a lot about mask wearing and hygiene measures in the last few years, so I'm not going to go into too much detail about that. Okay, so that's some background here. So the objective of this study that we've been working on for the last year or so was really to evaluate the likelihood of these spillover events, both from people to the pigs and from pigs to the people, and then to look at practically what should we or could we be doing to reduce this likelihood of transmission. And I want to just mention a word of caution here. This project was largely in the world of risk assessment, and I think of risk assessment as sitting between science and risk management. So what we're trying to do is take the scientific evidence available and from that develop some meaningful and helpful information that is packaged for risk managers to make a decision. And that might sound a little bit kind of theoretical and vague, but if I may, I'd like to ask you, for example, about a situation where you may have done something like that. So how many of you have planned a journey to somewhere you've not been before and you've checked Google Maps to see how long it might take? Okay, most people. So, and how many of you have kind of used the function in Google Maps to check what's the minimum amount of time and the maximum amount of time that it might take at different times of day? Okay, so most of you are in fact risk assessors, so I'm glad to see that. So you're used to thinking about this way, in this way, and risk assessment is really a way of formalizing that approach and trying to make it as objective as possible, so that risk managers can make decisions that take into account then not only the scientific evidence, but also all sorts of other factors, such as finances and what's the kind of political landscape and so on. So I'm not going to focus too much on this, but just to say that there are kind of formalized approaches to risk assessment, and the one that we used was developed many years ago by the World Organization for Animal Health, formerly known as OIE. And they're interested in looking at the risks of trade between countries, and particularly when it comes to infectious diseases. And we're applying that just onto a single farm and looking at the human workforce and pigs, but it's essentially the same principles. And the way they approach that is to break down this one risk that we're interested in into a series of interdependent risk steps. So you can think of these as conditional probabilities. And it can be done in a very quantitative way where there are data available, or we can think about it more in a qualitative way where there may not be data available, but we can start to think about whether the risk is negligible and is just small enough that we could ignore it, or whether we think that it happens most of the time. Another aspect of this is uncertainty. And so this is where the kind of word of caution really comes in, that often we don't have the data that we need. If we did, we wouldn't need to do risk assessment, right? So often we're dealing with uncertainties, and the formal approach of risk assessment involves trying to qualify and describe the level of uncertainty that we're dealing with and communicate this. And in evaluating both the likelihood that something's going to happen and the uncertainty, we have to be aware that although we're trying to be objective, we all know that cognitive biases exist, right? So we can have different groups of people look at the same data and come to this different conclusions. So if I tell you that you are infected with a disease, but you're 99% likely to survive, you might feel differently than if I told you have a 1% chance of dying, okay? So we have to be aware of that and try and reduce those. And part of the process of trying to be rigorous in risk assessment involves incorporating multiple stakeholders and getting different opinions and different sources of data to try and validate the overall conclusions. And we are still in the process of finalizing that. And the results that I'm sharing with you today are very much preliminary. So I encourage you to be critical when you look at these results and consider the biases that might be at play. That said, these are the categories of probabilities that we've used, and you can see that if you look on the left-hand side here, you can see that we can qualitatively describe these different levels of risk. So we have negligible, in which case the likelihood is probably so rare that it can be ignored. And we somewhat subjectively assign numerical ranges to these. So we're saying anything that has a likelihood that is less than 1 in 10 to the 9, we're going to call that negligible. Okay, so this is where the subjectivity comes in. On the other end, we have very high, in which case we're saying that almost all the time we think this happens. And in our case, we're saying that we're calling that 80% or above. Okay, and then we also systematically assign uncertainty categories to each of these events that range from low to high. So in the case of low, we would have several precise estimates from the literature that we can rely on. In the case of high, we may not have any data. We may be thinking about the what's known about the biology of the system and what even the opinion of experts. Okay. So to break this down a little bit further, I'm going to show you 2 pathways that we were looking at when we were considering interspecies transmission. The first is from the pigs to the workers in this indoor hog farm. Okay, and we're just looking at one farm in one 6-month production cycle. So we just had 3 risk steps that we were interested in. The first is, how likely is it that the influenza virus is coming in the piglets? The second is, given that it's present in the piglets, what's the likelihood that it's going to spread to the workers? And then finally, we were interested in, if the workers are infected, what's the likelihood that they develop symptoms? Because we all know that for each pathogen, there's a certain probability that we experience no symptoms or very mild symptoms, and this varies according to different influenza strains. So we did break this down by subtypes, and you may be familiar with the way of categorizing influenza viruses. You may have, in fact, heard about this in the news, for example, if you've heard about high pathogenic avian influenza, which is usually H5N1. Likewise, there are a number of different subtypes, and each of those tends to have a predisposition to spreading within certain animal populations. And so the subtype's important. That said, it's still a fairly broad category. And within those subtypes, you still see a lot of variation. But I'm going to present to you, just as a way of kind of leading you through the process, the data that we were able to compile on H1N1, which is very common in swine populations and also very common in people. Although I will say that within the subtypes, within the H1N1 subtype, it may not be the exact same viruses that are circulating within people and pigs, so it's important to be aware. So for the first risk step then, we were able to gather some surveillance data and a limited number of field studies, and although our uncertainty was pretty high, we were able to come to the conclusion that the probability that a given batch of piglets being infected with H1N1 ranged between low to very high. Again, very high uncertainty, because these field studies, even if they may have been very precise, were in limited populations, limited times, and we're trying to infer something about the current status across indoor hog farms in the US as a whole. And again, the data that we have for spillover from pigs to people, again, we had medium uncertainty. Many of the data that we had is really based on specific incidents where interspecies transmission was observed in a specific setting. And again, we're trying to infer something about the population as a whole. But I'll give you an example from one of these papers that's listed. During the 2009 H1N1 pandemic, it just so happened that a swine worker had been in South America, become infected unknowingly with the circulating pandemic strain, and then had gone back to work at the swine farm in Canada. And because they were diagnosed and it was recognized that they were infected with the pandemic strain, very quick thinking and good planning kind of came into action, and they set up a very quick surveillance study where they actually collected samples prospectively from the pigs and were able to observe the frequency at which transmission happened from the workers to the pigs. So we relied on data like that. And then we also, for this issue of spillover from pigs to people, developed a mathematical model. And I don't have time to go into the detail of that today. I'm happy to discuss in the questions a little bit more. But this is a compartmental model where we use mathematical equations to describe the rate at which different steps in the phase of an outbreak occur. So we have essentially, we're assuming a susceptible population at the beginning of the outbreak. We're assuming a certain rate of infection. And then once pigs become infected, they develop immunity, which is protective for a certain period of time, so they can't then get infected. So this is a classic epidemic curve situation. If you look at the red line, you can see the number of infected pigs. And in a completely susceptible population, you get rapid increase in the number of pigs, and then that wanes as they recover from infection and remain immune. So that if you look at the panel on the left, which is labeled A, we're looking at a completely susceptible population. And the panel B on the right, we simulated the same situation, but assuming that the sows that gave birth to these piglets had been vaccinated. So there was some level of protection conferred by the maternal antibodies. And so you can see that the infection curve is slightly broader and flatter in that situation. So we used the model to explore different scenarios and look at the rate of spread in the pigs and also the frequency of spillover events to the workers. And you can see here just another output of the model. So this was a stochastic model. which meant that we weren't just looking at what happened on average, we were also looking at a range of possible outcomes. We're looking at not just in a specific instance when it's most likely that people will get infected, but if we were to do an experiment and do this hundreds of times, what's the range of time till human infection, and what's the likelihood in each of those instances that infection would occur. So the y-axis here is the probability of a workforce infection over a single production cycle. And then the x-axis here is the vaccine efficacy. So we've got 0, or in effect, no vaccination of the piglets, ranging up to 60%, which is probably the limit of the vaccines that we have available today. So this would be assuming complete vaccine coverage and perfect handling of the vaccine and so on. So you can see that with vaccination, we can reduce, according to our model, the probability of workforce infection from about 60–70% down to about 25%, but still pretty high frequency of workforce infection according to our model, assuming that the virus is present in the pigs. Okay, so then the last step was assuming that the workers get infected, what's the likelihood they develop symptoms? And we, from the literature, again, very limited literature, and a lot of heterogeneity in terms of different strains of influenza, but we think that this is probably moderate. So there are probably a reasonable proportion of swine workers given infection that would not show overt symptoms. So given that we've estimated the probabilities and associated uncertainty with each of these steps, we can then think about combining these using probability theory. So we know that when we combine the conditional probabilities of multiple steps occurring, the ultimate probability of them all occurring is less, right, than each of the individuals. And we use that kind of principle in risk assessment to combine even qualitative risk categories. But just as a kind of way of trying to get a handle on the likelihood, I have given here the quantitative ranges for these likelihoods. So the combined probabilities of piglets being brought onto an individual farm, being already infected with influenza, and them infecting a worker, we think is in the range of very low to high, which is about ranging from 1 in 1,000 to 8 in 10 production cycles. Now, you'll notice that range is very high, very wide. And we've really kind of here, as I said, these are preliminary results, and we've taken a very cautious approach here. So at each of the extreme ends, you can think about those extremes as being quite unlikely, because it combines the lowest probabilities of each step or the highest probabilities, and it's somewhere probably in the middle. But nevertheless, we think it's likely or even probable that transmission between the swine and the workforce occurs pretty frequently, even when we're looking at a single production cycle on a single farm. So if you then scale that up to the national swine herd, you're looking at quite a this being quite a common event. And then we can look at then the likelihood of there being symptoms in the workers as a result of this infection, then reducing the likelihood again. So again, there's a fairly high probability that you could have spillover without any symptoms in humans, as well as actually having overt symptoms in humans as well. And I'm not going to go through in detail the reverse pathway. I'm just going to skip through these slides because we basically did the exact same process, but looking at spillover from workers to swine. And I think hopefully it's intuitive to you that if we only have 2 workers on the farm, then the likelihood of bringing the virus in, even if it's common in the human population, is going to be much lower than bringing on 4,000 piglets. So it kind of makes sense that we thought that the likelihood of spillover from workers to the pigs is somewhat lower. So we think this occurred or occurs in fewer than probably 8 in 1,000 production cycles. But again, if you scale that up to the entire national herd, that's still, you know, we think it's happening, you know, within a year in the national herd. Caveats aside. So finally, I just wanted to give you a little snapshot of what happened when we combined the different subtypes. Again, we had a lot more data for the H1N1 subtypes, and we know that this is very commonly circulating in pigs than in people. But I'm putting here a number of just a couple of other viruses for comparison. So H3N2 very sporadically spills over to people and has been associated with backyard pigs. And H1N2 also very sporadically spills over to people. We know that there was an instance in the west of the US fairly recently of that. But I've used color here just to highlight kind of the upper level of our uncertainty range in terms of how likely these events are. So the most likely event is transmission from pigs to the workers, which we think happens in fewer than 4 in 10 cycles. And then going down, we think that the H3N2 variant spills over to workers less frequently, still fairly frequently, and H1N2 variant less frequency. And again, spillover from worker to pigs is less common. I think we can be fairly confident of that just because of the population sizes. So I'm hoping that the limitations have been fairly clear. It's based on limited data. And you'll see in the conclusions that I think that's something that we should address. We also didn't include viruses that we don't know about. Obviously, we're focusing our efforts on viruses that are known to be present and that we know, whether we understand. But obviously, everyone here has been sick with a respiratory virus and not been sampled. So we not gone to the doctor and had a sample taken and had it genotyped. So you know that, you know, there's a number of viruses circulating and we don't always know which subtypes all of them are. And then also we've very much looked at just this one unit of analysis, which is a single production cycle. But we know that there's a lot of variation across seasons in terms of influenza. And there can also be spatial heterogeneity. And there's also constant evolution of influenza viruses. And finally, an important point is that after infection, we typically develop immunity that protects not only against that specific strain, but against the most closely related strains. So immunity is an important part of the transmission of influenza, and all of these factors could affect the likelihood of spillover between different populations. So to kind of tie it all together then, we, based on this preliminary analysis, we think that spillover events are pretty frequent between commercial indoor grown pigs and the workers. This is high enough that it could play a role in the evolution of swine viruses, and perhaps should be considered as an important component of pandemic preparedness. And I think I would echo Max's point of, you know, perhaps we should be thinking about enhancing the surveillance in these populations. There is some surveillance already ongoing, but it's on a pretty voluntary basis. There are other aspects to consider in terms of if there was an influenza virus to evolve that had pandemic potential, perhaps we should be thinking about swine workers as a key group to vaccinate. And finally, I didn't have time to go into the control measures very much, but based on our modeling, comparing different control measures, we don't really have access to a highly effective control measure for influenza in this system. We have vaccination, which has kind of moderate protection, and then there are other biosecurity measures that we can take. But really, in the face of an outbreak of influenza on a farm, we would really need to be applying this approach of having multiple layers of control measures to really suppress the likelihood of spillover between species. And I'm sorry to kind of rush through that, but there's probably a lot of things to discuss there that I'm happy to discuss afterwards. But thank you very much again for the invitation. I'm happy to take questions now or later in the day. Thank you. Okay, good question. Yeah, so in fact, at the beginning of the study, we had discussions about mainly what are the commonly used control measures and also what would be practical. So it's important to remember that all of these swine farms need to be economically sustainable, right? So there are certain control measures perhaps we could model, but they're just not going to be practical to implement. So we know that vaccination is used fairly commonly. We know that all out systems are, and then one thing that we kind of came up with in thinking about the system was the idea of being strategic in the way that the workers move through the farm. So if they, for example, in their daily work routine, attend to the most vulnerable youngest piglets first, and then move in a single direction through the farm so that they can disinfect before they go back to the youngest ones, that would reduce the likelihood of transmission between the rooms. So we looked at that as an example of something that may be practical to implement, but we need to follow up and find out if that really is.
We do have a couple of questions from the audience, from the Zoom audience. Wendy, if you could.
Oh, okay. Are you okay with the timing on that?
Yeah.
Okay.
How long is a typical production cycle?
So a typical production cycle is 6 months, roughly. Yeah, so that's the time from the piglets being weaned to them being sent to the market. To the slaughter.
We have one more, if that's okay. How well is the U.S. prepared for the next zoonotic to human pandemics? Are One Health approaches well implemented in Indiana and other states?
Yeah, that's a big and important question. I don't know that I can address all the aspects of that. Yeah, maybe that's a question for the whole day. I think, we can look at COVID as an example and look at ways that we could improve for sure. Like I said, there is surveillance. So the USDA APHIS is the agency that's responsible for that in pigs, but it's pretty much on a voluntary level. So we have to think about whether we as a society want to impose compulsory surveillance, for example. It's a big question. Okay. Thank you.
Thank you very much for both of the wonderful, informative talks. This closes the virtual portion of the 2023 Hampton and Esther Boswell Symposium. I'd like to offer special thanks to our virtual audience, and of course, all the speakers and people who are here today. And again, offer my most sincere gratitude, and I think that's echoed by everyone who watched this virtually and in person, to Thomas Boswell and Cheryl Boswell for their generous gift that made this possible. Thank you again to everyone.